So, question one, how often are your officers encountering fentanyl-related incidents now compared to 5 years ago? And you mentioned 5 years ago.
I would say Eric's probably the best.
Well, I think that 5 years ago was kind of right in the middle of when the Blake decision happened, where they decriminalized the hard drugs. So we didn't deal with it as much because we couldn't enforce it. But now it's multiple times a day, whether it be overdoses or people just using in open air, and of course the trafficking investigations that go on.
And then do you think, because you mentioned earlier it's like 75 cents a pill, do you think that also kind of contributes to it? Just like it's cheaper now, it's easier to access.
It is. 7 years ago, 8 years ago, the pills were $25 and $30 a piece, and an average user could use up to one pill per day. They would break that into pieces. But now there's users that are using pills that are 20, 30 pills a day. But pills are kind of phasing out because we have powder fentanyl now, which is much stronger, much more expensive. That's what the user wants now.
And are you seeing more of just straight fentanyl or a mix?
It's
or
always
a bit of both?
It's always going to be a mix because they still, the manufacturers still put binding material in it. They don't want it pure fentanyl because they don't want so many deaths on their hands either. Kind of closes their market if that happens.
And then can you describe the most common scenarios in which fentanyl is discovered or involved?
Most common these days are just driving down the street and seeing it being used in public, in the open. There's a few parts in the city that are obviously more prominent than others, but it's, I can drive down the street, and not that I enforce the user portion of it with my job, but I could make 5 or 6 arrests within 10 or 15 minutes just for the use or possession.
And if you have like any stats on that, how many arrests are happening?
On
average.
We can probably get that. That's an easier. I'll just make a note.
Okay.
Because, but that's an easier.
I get the cases that the officers are making arrests on for use and for distribution come to me, and I say that I process upwards of 10 to a dozen cases a week. And when I say process, there's some coding we have to do, some follow-up investigation if needed, and then sending drugs to the lab to be tested.
And then this might be like another both question, but are you seeing more users or more distributors?
Oh, users for sure.
And I think our agency's tried to focus on the distributors of it because trying to cut off the pipeline to the users, because the users, it's a possession charge, it's a misdemeanor. And a lot of that when they go through the court system, the penalties are relatively low, and a lot of them, what we lack here is a way for them, once they're processed through the criminal justice system, to get into some type of treatment or some type of follow-up, is where the issue comes with that. And so the goal is to cut down the availability to the people that are using drugs, and that's.
And then, not to kind of get political, but do you think that Trump kind of closing the border is helping less fentanyl appear in Yakima County?
I base my, assessment on that on street price. So we are seeing street prices go up a little bit gradually, especially methamphetamine. Powder fentanyl is, fentanyl, all drugs are readily available, but powder fentanyl is actually decreasing in price as of late. So to answer that question, I don't know. I would think that it is helping stop or slow down the flow just because prices are starting to rise. That's my only guess.
And then when it comes to things like, because I was talking with Safe Yakima Valley, when it comes to like a spike alert, especially when it comes to overdoses and just fentanyl, is the police department, are you kind of in on that with Safe Yakima Valley, or is that just them?
Yeah, we communicate with Safe Yakima as well. on a regular basis.
They provide the data to us, and we're looped in with them, and we meet regularly with them, and we communicate regularly and share data with them.
Has the fentanyl crisis changed the way your department operates on a daily basis? If so, how?
I think it's obviously the amount of caseload that we do. It's the way that when the laws changed to where it became a crime again, we're now again enforcing the drug laws. But the amount of users and the amount of availability is through my career and through Detective Orbaco's, drugs have always been unfortunately readily available. But the open air and the out in the public part of it, I think, is increased exponentially. And we have a PROAC unit that specifically works focusing on the line level or the dealers that are on the street, and then we have long-term investigations that are part of our task force. So it has changed daily, and obviously that is an increase in the number of aid calls we respond to when fire needs help. If they call and ask for assistance, with the price of drugs going up, you're going to see a spike in property crime because the users that are using on a daily basis have to fund their drug habit at some point, and usually that's done through theft, or thefts either at retail outlets or burglaries, car prowls. So I think you're going to continue to see, if the prices go up, you'll see a spike potentially in property crime, as well as or violent crime where the robberies and things like that will increase.
Do you feel like you have enough resources? Not that YPD, Sheriff's Office, law enforcement in general is not doing their best, but do you feel like there could always be more?
I think for our community, we are stretched thin. The men and women that work here are overloaded with the amount of work they go to, the number of calls the detective division takes on, an inordinate number of cases that they investigate, and I think our community could use 20 or 30 more police officers to be really effective. There's a lot of things that we would like to do. It's just a matter of staffing that allows us. We have to respond to our basic service calls and provide those services in the field, and then we have to decide how we allocate the other positions. And so if we were to be at least fully staffed, but at one point our agency was approaching 150 officers, and we're down to 137 right now. And so and then with that comes with vacancies, injuries, people in training, etc. So we're forced in our command staff to make decisions on where to allocate people and where to assign them and what investigations take priority. And with the amount of drugs in our community, we could use several more people in our drug unit. We could use more people in our PROAC unit to help cut that supply of drugs to our community. And with that is more bodies. More bodies, more intelligence gathering systems, and a lot of that is funded, obviously through the city. And we try to find grants, federal grants, state grants to help with that. But that money is not always readily available to our agency. So.
And to kind of get into one of the questions I had for the mayor, in regards to money and going towards law enforcement, what does that look like? Especially when it comes to fentanyl, drugs, just in Yakima in general.
Are you talking how much money we spend on that question?
Yeah, kind of. How much money is kind of allocated towards the drug problem in Yakima?
Well, we don't specifically have a line item that it is. We have, right now, we currently have 2 detectives and a supervisor in a task force that their primary job is to investigate long-term investigations into drug trafficking. We have 4 officers that work in our PROAC unit, which kind of focuses on the street level narcotics. We have all of our detective units inevitably move into investigations that involve drugs. So, it's hard to put a dollar figure on it because of different pays that people make, etc. And then the patrol officers readily encounter all those 10 to 15 cases that Detective Orbaco talked about are patrol officers that are encountering it. So it's kind of a department-wide effort to try to deal with it. And whenever we have, we have people assigned to the ATF, we have people assigned to the Marshal Service, all those seem to fall back into drugs because a lot of the criminal organizations in our valley, gangs, etc., are all involved in drug trafficking for the most part. And so it's kind of all-encompassing on behalf of the whole organization. So it's hard to put a specific dollar figure on it.
Right.
I can tell you that drug trafficking investigations other than wages, are all funded from prior drug seizures, whether that be vehicles, residences, or just bulk currency. So we try not to use the taxpayers' money to investigate drug trafficking.
Do you feel like it's all do you feel like it's steadily increasing, stagnant, or going to decrease over time?
When I started seeing fentanyl in this county up to this point now, I was very little when the crack epidemic was going throughout the country, but I've never seen anything like it until we started seeing fentanyl, as far as how many people are selling it.
Because it just takes one time.
It does.
Well, and the other thing we've seen a significant increase on is impaired driving related to fentanyl. We respond, I mean, I hear the radio calls almost daily where they're responding to somebody who's passed out behind the wheel, and almost every time that's somebody that's overdosing on fentanyl behind the wheel of an automobile. So our agency has drug recognition experts that process those people for DUI. But I mean, that's becoming another major issue in our community because people are getting behind the wheel after using fentanyl.
That's an interesting point you make, because I feel like the stigma or notion out there is that fentanyl is only happening among the homeless.
No, it's across the board. Some of the other types of investigations we do are investigate the overdose deaths. There's a statute in Washington that is basically like the equivalent of a manslaughter charge. And on the ones that I've been a part of, it has been anywhere in town: West Valley, Scenic Drive, Central Yakima. The youngest person we've arrested for drug trafficking was 13 years old. The oldest that I personally have arrested was 75 at the time, and that was for a death.
Do you, this might be a touchy question, on Narcan. So I've been kind of asking, commissioners, Safe Yakima Valley, what kind of their stance on Narcan is, and not to speak of Narcan in a negative or positive way, but what would you say to those people who believe that Narcan is allowing users to just continue to use?
Well, I would say it's readily available. All of our officers carry it in their cars, and it's available for use for themselves if they're exposed, people that are overdosing, etc. I think I would agree that the readily available Narcan saves a significant number of lives every day, and a lot of it's being handed out. And there's ones that the police or fire never go to, that people are sharing. The people that are using are reviving their friends or people that they're using with. It obviously saves people's lives, so there's a benefit to it there. The availability of it, I mean, it's a bigger question, I think, than law enforcement. I mean, I'm trying to think of the way to say it. Basically, it's a hard question to answer, because if you didn't have Narcan, we'd see I don't even know how many fentanyl overdoses in our community every year. And which is a tragedy for the family and for the person and for an entire community when people are dying from this. So I think that what the biggest issue I see is there's not enough resources available for if people were to choose to get out of the lifestyle, because our role is a very limited. We have the interaction as far as the criminal justice system, and you'll see a lot of people go to jail for drugs, and when they walk out the door at midnight, there's nowhere for them to go. So a lot of people, even if they are willing to choose their lifestyle, change how they want to live, there's nowhere to be able to move on to. And that's not a role that we as an agency, we're equipped to handle. That's something that has to be funded outside of our department. So Narcan does allow people to continue to use, but it also helps them survive, which, I've seen it, it's a tragedy if that person was to die, so.
True. And I feel like probably numbers.
No, I completely agree. That someone could use Narcan 10 times throughout their use in their life and maybe that 10th time is the one that said, okay, I'm done with this, but there does need to be something in place where when somebody's ready to go, they can go now, not come back in November and we'll see if we can get you a bed.
And there's a lot of talk in the community to try to help with that. The jail's involved. I've been a part of it, and Detective Arbacco and I have been in Safe Yakima. We have these conversations, and it's just if you get out at midnight and you're expected to show up at a treatment center at 8 a.m., the likelihood of that person showing up is very, very small, because what do they do from midnight to 8 o'clock? They potentially run across their friends, and luckily I've never been in a position to have that kind of urge, but you talk to people that have that urge, if they're around the people that have the drugs to use, and I remember talking to people like heroin, etc., and fentanyl, I'm sure is the same way. The urge is just there, and the availability, and eventually that person never makes it to their 8 o'clock appointment to try to get help. And like in bed dates, like you're talking about, treatment centers are months, sometimes weeks or months away, and it's really hard if they're living on the street and they're camping out and there's nowhere for them to go. So it's a larger problem than just a criminal justice system can address.
Yeah, and I even after speaking with Alicia, she was mentioning that their friends aren't even really their friends. It's just another reason to get their next fix. They're not thinking about food, they're not thinking about water, they're not thinking about a daughter or a son or a mom or a dad at home. That's what's on their mind 24/7.
True.
Do you believe this is simply an unsolvable issue? Is this a fight that law enforcement can realistically win on its own? And I feel like you kind of already answered that.
No, I think that we have a role in the process of trying to solve this problem, but we can't win it on our own. There's no way that we could arrest our way out of this issue. And I think Detective Arbacco talked about it, but I've talked about it already again, is if somebody is willing to do treatment, somebody goes to jail for 3 to 6 months and they walk out the door and they don't have a stable place or stable plan once they leave jail, the likelihood of them falling back into that lifestyle is very high. And that's not something that criminal justice system or the police department has the ability to impact once they leave jail.
Is there any system in the jails that help with that treatment's offered?
There is.
Oh yeah.
Yeah. There are several individuals that I know of that seek out people that are either like booked that day or getting ready to be released, and they will go meet with them and offer them the services, and there's a gamut of things that they can assist with, and they have to want to do it though as well, and they don't get a lot of that. When they do get that, they go to the extreme to make sure that they keep their end of the agreement, but ultimately it's up to the person that needs the help.
AMR mentioned the same thing, how they go out, administer Narcan, they advise them to go to the hospital, but they end up just getting up, walking away.
And Director Welch has taken some forward steps over at the county jail. I don't know if he's included in your process of doing this, but he has taken some steps to try to help with that. So I'd encourage you to speak to him if he's not on your list of people to speak to.
Yeah, I'll do that. He wasn't on my list, but no, I will do that.
And he's doing some things, I think, in his existing budget to try to help with that. He's got a group that meets and they try to, housing and things like that for when people get out. So
this kind of reminds me of when speaking with Safe Yakima Valley, because the next question I kind of want to ask you is, how can the community kind of get involved? Because if you think back to the crack cocaine epidemic, war on drugs, it was the public that really helped get everyone past that stage. So how do you feel like community involvement now, how can the community be involved now in helping with the fentanyl crisis, if any type of help?
Well, I think it's just awareness. I mean, it's educating this potentially could touch any family in our community. I think, and that's making themselves aware, sharing it with their kids, their brothers, sisters, and the education piece of that, being willing to accept that if somebody is in their family, to be able to try to help them. And Detective Arbacco hit that kind of hit the hardest part of this. The person has to be willing to accept or be willing to move forward with treatment. But I think educating themselves, being the understanding of how to keep. I have 2 daughters that I talk to regularly about this issue, and not trying to turn a blind eye to it, because like Detective Orbaco said, this doesn't affect, and I think there's the thought process that it's a downtown North First Street, the Natchez Parkway problem, but this reaches, our overdoses are all over the city, all over the county, and it's not really a socioeconomic issue. It's an entire countywide or statewide or nationwide issue that touches all ethnic, all socioeconomic levels. And so I think the more they can educate them, be willing to be a part of the solution. I mean, there's a lot of things that people can do on their own or become part of these groups that help with that. And unfortunately, we see a lot of people join after tragedy strikes their family. So be proactive about it and see what they're willing to do. Do you have anything else, Eric?
No, I agree.
How often would you say your officers administer Narcan? I know that might be something you kind of write down in statistics, what I mentioned earlier.
Yeah, I don't know. I know we're running short on it, unfortunately. So, I mean, more than we probably. A lot of times we don't even know about it. I wouldn't know about it, and they do it. And
I think for us, it's not as common, just because the Narcan that we keep is for ourselves. How can we help someone if we're exposed as well? But obviously the medical, paramedics, fire, they go through a ton of it. I couldn't even begin to tell you how much they're going through.
I just heard of a person we arrested that needed four administers of Narcan before it came around.
Yeah, it's another thing
And I showed up on a scene one time. I was working late, and I was on North First Street, and the people there had already administered it. So I didn't end up, because they had actually a needle and they had it in a bottle and they were giving it to the person when I got there. And then the aid car gave him more when he got there.
It's interesting, because after speaking with AMR, he goes, oh yeah, 3 years ago it would have took 1 dose and they would have just been brought back to life. Now it's taken 2, now it's taken 3, now it's taken 4. So the potency is just getting more stronger.
Mm-hmm.
That's just, goodness. Do you have any partnerships, Safe Yakima Valley, partnerships with mental health or addiction recovery agencies to help repeat overdose cases? Any other organizations other than Safe Yakima Valley?
Oh yeah, we're connected to a lot of. Whenever we go to a meeting, there's usually like Merit Resources. There's Triumph. Whenever Detective Orbaco attends more than I do, but when you're in there, you got prosecutors, you've got defense attorneys, you got judges, you have the jails, you have the criminal justice system, you have most of the providers in the community. The DCR is comprehensive. You have Triumph Treatment. We have a decent partnership, I know, with Merit Resources. Mm-hmm. That they actually had the contract through the Blake decision to try to provide treatment, the Recovery Navigator program, which is a lot of them are actually recovering people that are in recovery that try to, through life experience, try to help people that are in drug addiction. And they're on North 4th Street, I think.
Yeah, we give them. My supervisor gives them referrals on everybody that comes through, or that is arrested for a drug-related crime, and then it's up to them to seek those people out. Typically, they're pretty quick about it. So, because unfortunately, drug crimes they don't stay in jail very long, especially the users. So they try and get them before they get out to offer those resources.
And how often are these meetings, would you say?
A lot of them are quarterly, usually.
Quarterly, or just I'm in constant communication with one of the outreach workers as well, like very frequently. And then same with Alicia as well. She's very, very good at networking, and so she puts us in contact with a lot of people as well.
We actually hand out the Recovery Navigator stuff to all of our DUI arrests. Even though they're not all fentanyl, mm-hmm. We give people treatment referrals, because a lot of times people that get picked up or arrested on a DUI, they've got substance abuse problems. So it's a lot of them are ordered by the court, but we are handing them out to just people we arrest every day in the hopes that they'll seek treatment for themselves. And we've had some success stories with it, but not as many as we would like.
What kind of toll would you say it takes on your officers? It's got to take some type of toll. Even if like, think about AMR, think about the fire departments, just you're bringing someone back to life, and they may constantly, like the officers are constantly most likely seeing them just get up and walk away.
Well, I think I know one thing I would always see, and I hear a lot of, is frustration with the system and with the processes and with the criminal justice system, et cetera. Our officers, and I've heard it from a lot of people, that in my belief, and I think all of law enforcement in this valley does an outstanding job at doing their jobs and trying to arrest people, hold them accountable, send the cases to the prosecutor's office, and then just based on the system, a lot of times people are out, the overwhelming, the criminal justice system. Detective Orbacco and I had a conversation that they arrest people for drug trafficking, and they're either on low bail or no bail, they're released and they're back out on the street, and he's re-arresting them in a very short period of time. And so I think there's the emotional and mental toll that has to do with daily seeing the violence and just the lifestyle that people live, and the hard, that takes a toll mental health wise on our officers, because of just the lifestyle that people choose, or the violence associated with it, or the apathy that people have for themselves and others. But there's also the frustration, and it's frustration that's felt not just by myself, but a fair amount of our officers and throughout the valley, and I think it's probably statewide, of just where it almost feels like sometimes you're spinning your wheels, because you're rearresting the same people, and the consequences just don't seem to match the crimes that are being committed and the devastation that it's causing in our entire community. Do you want to expand on that?
We as investigators or as law enforcement, whether it be a misdemeanor or a high level felony or an overdose, death arrest, whatever the case may be, we put together the best product we can to move forward through the criminal process. And there's cases that, armed drug trafficking, it doesn't seem to be a big highlight with the court system, and they're released very quickly within a day or two, including someone that we arrest for controlled substance homicide. They're out in just a few days, and our frustration is that they don't stop selling drugs. They the day they're out, they get their cell phone or they do whatever, and they start right back up. And we rearrest these people, we reinvestigate these people, and it's kind of gets to a point where it's like, why am I doing this again? We did our job. So
do you ever feel like it's a waste of resources?
Never. I don't. We're here for a reason, and at the end of the day, our reason is because we need to prevent death, and drugs kill people. And so no, I don't ever feel like it's a waste. I think more resources should be added. Drug crime, or crime in general, is I would say 80% revolves around drugs. So no, I've never felt that way, and I've been investigating drug crimes quite a while. So
I don't think I have anything else. Is there anything else that you'd like to add that I didn't ask you about today?
No, just that I think there is kind of a stigma amongst law enforcement that we're out there trying to just lock everyone up and throw away the key, and that's just not it. We're human beings as well. We don't like seeing other human beings die, and if we can be a part of the team that solves the problem, then we're here.
You are all set for me.
All
right, thank you.
Okay. Yeah, you're welcome.
You got them all dressed up.
I know.